Hi, my name's Allyssa Hinckley. I'm a veterinarian and a mom of an SLC 6A1 kiddo, Weston. Amber asked to have me speak about the patient experience as an SLC parent and the parallels I've seen in my career as a veterinarian. There have been many experiences in my life that have shaped the way I practice medicine. But to be honest, there is nothing that has altered the way I practice medicine like having a kid with a rare disease. I'll never see a client, a patient, or exam room the same. I practice in two drastically different fields of veterinary medicine: emergency medicine and rehabilitation medicine. Within a week, I will deal with a dog that's been hit by a car, multiple organ failure, or cancer. And then I'll also deal with a chronically painful patient or a patient recovering from a hip replacement. In the ER, we deal with the immediate medical threat. But in rehab, we deal with the biggest functional challenge that patient is facing. For example, in the ER, we're dealing with things like hemorrhaging or AFib. But in rehab, we're dealing with urinary incontinence or difficulty getting up. Now, you would think that the ER challenges are the only life-threatening ones, but in reality, the rehab challenges are just as impactful. So how does this relate to our SLC 6A1 kiddos? Sometimes the most impactful challenges of our lives with our kiddos are not always seen as the most medically important. I can't speak for every SLC kiddo or family, as we all know that the symptoms of the kids have a wide range, making it all the more important to truly understand your patient. So I'm going to walk you through the journey we have had with Weston, along with some patients that I've seen recently that felt all too familiar to some of the experiences we have had with Weston's medical journey. Weston's medical journey began very early on with becoming aware he had vision issues. I began discussing my concerns with his pediatrician, who was willing after several months to send us to an ophthalmologist, where we found his eyes had difficulty seeing and working together. We were hopeful that vision would explain away the other things that we were noticing as well, and we did see improvement. Little guy in glasses and ever. It's always so cute. We did see improvement, but it didn't make the feeling in my stomach go away as a mom that something larger was lurking. Then came the challenges in speaking. Keep reading, keep talking, and it will come. All kids develop differently. Now, I by no means want to shame my pediatrician, as he faces so many concerns and challenges daily that often do need to hear, keep reading, keep talking, and it will come. But I do want to explain what this journey looked like for us. Next came the atonic seizures that were growth spurts, an abnormal crawling, inability to connect, poor eye contact still, no speech, potty training challenges, and eventually a weekend full of drop seizures that landed us in the ER. Once we got the diagnosis of epilepsy, we began the search of trying to understand the why. Doctor's appointments, MRI, EEG, and then the diagnosis of SLC 6A1. Finally, due to the efforts of you guys in this room, we had a name to the struggle, a name to the questions. Although we know a large amount of SLC, when discussing with our original neurologist that met with us in the ER, the follow-up was, who knows about it? Maybe it does something, we're not sure. Hearing a diagnosis followed by silence is by far one of the most challenging issues with this disease. It wasn't until I did my own digging and in research I did find more information and doctors willing to discuss SLC with our family. Once hearing of Weston's diagnosis, I became the client I dreaded. Now, mind you, I've already been the client that said, I don't know, something just doesn't seem right, which was hard enough. But now I was a client with a patient where the challenges far outweighed the solutions. So how does this relate to the patients in my field? Who are the clients that I relate to the most often? It is always the clients that have not been heard, haven't been seen, and challenges not discussed or acknowledged. When I see patients come in that are dealing with recovering from a knee surgery, the knee surgery part is the smallest of the challenges they're actually facing. In reality, it's often the extreme separation anxiety that is set in after surgery, where the dog has destroyed crates and left teeth marks on walls because their anxiety is too intense for them to bear. It's a paralyzed patient that can't urinate, and no one thought to help the owner manage bladder expression or how to move that patient safely, but only spoke to them of the MRI results. Most recently, it was my patient Doodles. Doodles was an old lab that suddenly became paralyzed due to spinal embolism. We had 4 vets prior to coming to me, and all had recommended euthanasia. As I spoke with the man about his dog, I told him that the deep and difficult challenges the dog faced. We discussed what things were most challenging for Doodle from his owner's point of view and from Doodle's point of view. We chatted about what we needed to do to ensure that Doodles did get comfort and quality of life to return. And we discussed what options we had to see if that was even possible. Doodle's owner, a grown, burly man, began crying. We were the first ones to even have the conversation about how we could potentially help, instead of just dismiss his concerns. When the grown man in my room began tearing up because no one else would even discuss options with him, I wondered how many conversations as I, as a veterinarian, denied a client. How many conversations as I, of a mom, been denied? The story of embracing the difficult conversations, in Doodle's case, ended in hope and joy, and Doodles was able to walk again. Why are these the clients that I relate to most often? It's because their full symptoms and experiences are not addressed. It's because although Weston's seizures are incredibly challenging, they aren't his only challenges. Weston's life is also severely impacted by being able to go to the bathroom, to control his body and awareness in space he's in, to be able to speak, to sleep through the night, to connect and create relationships. And I know this is true for so many SLC patients. The SLC support group has questions about medication, but also so many questions on how to deal with side effects of meds, sleep, behavior challenges, car safety, emotional swings, school, and so much more. It is so incredible to have the family support group as a resource to go to for information and connect symptoms and not feel alone in this journey. The times we have made the most progress with Weston have been when the doctors invited us into the conversation to chat with about all of his challenges. Combining the incredible knowledge of the scientists and the doctors with a deep understanding the challenges our kids face by the caregivers is when progress truly happens. It is the people in this room that are truly doing this, integrating the challenges with the science. We know as SLC kids parents that our kids' challenges are not easy, nor do they always have solutions. But even though a solution may not be present, the conversation is needed. To hear our concerns, the full spectrum. The most impactful challenges they face may not always be the ones listed at the top for SLC, but they might be the ones challenging the quality of that patient's life or that caregiver's life. Just like in Doodles, this is what I hold on to for SLC, that the discussions will happen, and of course that it ends with hope and joy. I can't thank the scientists enough that allowed for us to finally put a name to the challenges we face, and I'm so thankful for the scientists that will find the treatment for our kiddos, that no more parents will be met with silence after a diagnosis. But let me talk about treatment options. There is no one more important in that role of hope and joy than you guys in this room. Your willingness to step into your lab and continue your research, your ability to be a doctor, willing to see our kiddos and hear our concerns and have difficult conversations. All of you are acknowledging a journey that is often silent and invisible. So please never stop. Please never stop the conversation. Never stop searching for the hope and the joy that is to come, for I know that it is there. Thank you.